Well, joining us now, the former Labour Home Secretary and Health Secretary Alan Johnson, Shami Chakrabarti, Shadow Attorney General, and David Lidington, former de facto Deputy to Theresa May. It's good to have all three of you tonight, and it does feel like quite a night. Alan Johnson, I wonder if I can start with you. It doesn't somehow feel like a speech that you would hear in peacetime.
No, but government has a pandemic plan, a national plan. We had it. It was inherited by this government as well and previous governments. So all governments prepare for this. This is, one of those frightening things that is bound to happen at some stage. And the pandemic plan has various levels, and we've reached the level now where this speech tonight, this broadcast tonight, was absolutely necessary. For one reason, and Nick referred to it. I mean, I dealt with the pandemic in 2009, swine flu, which was milder than we all expected, but there were 457 deaths. The big difference is there were antiviral drugs that people could take at home that would help with the symptoms. A vaccine was also ready quite early, but that's a different story. There were antiviral drugs. I think with coronavirus, people were under the impression that they could get a dose of it, it wouldn't be too bad, they'd be up on their feet in a few days and, back at work. All the evidence now, and we know this much more, this is completely new, no one's ever experienced this before, so we're finding out as we go along, is that it is debilitating. However young, old, whatever preconditions you've got, and it's still the case that the older you are with conditions, the more at risk you are, but whatever stage you're at, you will really feel this. It'll be debilitating, and you'll want to use the NHS. And if the NHS is swamped, that is our greatest bulwark, our greatest safeguard against this pandemic. We'll overwhelm it, and then it will be unable to defend us.
We heard from Nick a moment ago speaking to a cabinet minister who described it as sailing into a storm. We know some would have pressed to see these measures much earlier. Would you have liked to see this earlier? Would it have been possible to do this earlier?
I've got no appetite for the kind of politics of this, too early, too late, too soon, too little or whatever. At the end of this, just as after the pandemic that we dealt with, which was an H1N1, by the way, the first time it had appeared since 1918 and the famous Spanish flu, afterwards there'll be an independent report, and then we'll get all that out of our system. But at the moment, what the Prime Minister said tonight, I agree with every word, and I think every household that listened to that needs to be aware. We are a democracy. It was much easier in China to deal with this when it first struck, because China is a police state. Much more difficult here. And I think after the weekend, when we saw people going out as if none of the messages previously had any effect on them, it was very necessary to make this broadcast tonight.
And I wonder what you were feeling, Shami, as you watched that. You haven't always been on the same page, certainly on things like ID cards as Alan Johnson. Presumably there's nothing there that you would disagree with tonight.
Correct. And in fact, with a heavy heart, of course, Labour was calling for a greater enforcement of social distancing this morning because the previous strategy just wasn't working. Somehow people were not getting the message. And lives are being lost. And I agree with everything that Alan Johnson has just said. I would only add, however, that now going forward, and we are taking a bipartisan approach to this, and we've been in talks with Matt Hancock and other ministers, for some time to try and adopt a bipartisan approach. We still need greater clarity, for example, about who essential workers are. So Sadiq Khan, our Mayor of London, has been saying, I believe, just this evening, that construction sites really ought to be shut down because those workers ought to be staying at home and leaving public transport and so on free for the truly key workers. And
you're saying the same, are you? Would Labour now be calling for all construction sites to shut down?
Well, if that's what the Mayor of London's saying, I think that must be right, because otherwise we're just putting lives at risk. This is incredibly serious, as you've described. One final thing, I think that there will be many millions of people who are very afraid at home tonight, but particularly the economically vulnerable, particularly those who are self-employed, who are in the gig economy, people for whom the Chancellor's package is really not enough. And that's going to be incredibly important if we're going to ensure compliance as well.
We haven't got the government with us this evening. We have got David Lidington, who was formerly Theresa May's deputy. Give us a sense, David, if you can. What do you understand the government saw or discovered tonight to make this such a sharp change of tone from yesterday?
Well, I'm like everybody else, sort of reading from what I've seen in the media. I've not had any sort of confidential briefings from government ministers, but my reading of this, looking at how they've spoken, how the Prime Minister spoke tonight, is that there are two things. First of all, that clearly the scientific evidence was saying that if current trends continued, there would be a very large number of deaths. And my guess would be, on the basis of what Chief Scientific Advisor said in the past, you're looking at the tens of thousands at least. And secondly, as Shami said, I think ministers and officials will have looked at what was happening in the streets, particularly in the big cities, but also these people just driving to seaside resorts and beauty spots like Snowdonia and the Scottish Highlands, and realising that they needed to take some very drastic and immediate action. I think the Prime Minister's address this evening did match the moment, but none of us, I agree very much with Alan said, none of us should underestimate that for ministers and their advisors, this is a choice between different bad options. We've seen, for example, in Hong Kong and Taiwan today, who appeared to be successful in containing the virus, then started to relax some of the stringent restrictions, and they've now found that there are new outbreaks of cases. So these fears about second waves are real. Yeah. Those risks are real. So I think we have to accept that the people in the room, in those COBRA meetings, are approaching this desperately wanting to take the decisions that will save as many lives as possible, but coping too with the reality where even the most expert scientists that they've got available around the table are dealing with a completely new disease. The evidence is coming in from the laboratories and from the records of other countries. But there are still to develop that knowledge as they go along.
There are still decisions that come at a political level, though, that many countries have been able to take much more quickly. And part of the problem with so many people going out was that they had confused messages. They heard from a Prime Minister who managed to confuse more people when he clarified things in his answers. He told us just on Thursday it would all be done and dusted in 12 weeks. He told us on Friday he'd go and see his mum on Mother's Day. He sounded appalled at the idea that police would be brought in just yesterday, and tonight we're hearing that they will be asked to enforce. This is a man who has confused the general public at a time when we are desperately trying and seeking clarity.
Well, I thought the tone he struck today was right. He did make the message clear after an initial sort of slight stumble on Mother's Day visits, and he and the government make it very clear that the best sort of Mother's Day present is not to go in person, but to send love and messages, good wishes remotely. I think there is a challenge for the government that's become very clear this weekend, which is the importance of clarity and repetition in getting through to the very large number of people in this country who don't watch programmes like this, who don't read newspapers, who very rarely, if ever, look at...
So where are those messages then? Sorry to interrupt you, but we had Get Brexit Done, we had Oven Ready. When it was politically expedient, we had those adverts all over the place.
I think my personal view is that there is a strong case for a sharper public communications programme that would include slogans of that type, that would include trying to enlist the support of celebrities who might have a cut through that politicians and even senior medics would not have. But please don't, let us, by all means, let us make suggestions about how things can be improved, but please let us not get caught in a political game about, who should have made what decision then. If you are in the room working under relentless pressure, trying desperately to make the right call to save lives.
Okay.
There's not a choice between good and easy on the one hand and subsidies on the other.
I'm going to go back to Alan, because you've been in the room, Alan Johnson, and I wonder whether you look at what's been laid out, and clearly there are more details to come. Is this enforceable? Do you think it is actually about having police on the streets telling people when to go back and asking where they're going? Or is this just meant to nudge a kind of new public morality?
No, it's enforceable. I mean, we police by consent in this country, but we've been through crises before, not least of all the Second World War. None of us were alive at the time, but, people had to do things differently. What the Prime Minister was conveying tonight is this is a crisis as big as we'll ever get in peacetime. And we've been fearing it for years. There's 3 pandemics every century, and we knew one was coming along. This one is particularly difficult because it will be a while before we can get a vaccine. And I think, to be fair to the Prime Minister, and like David, I think there's a time and a place for having all the Punch and Judy show about this. But to be fair to the Prime Minister, it was this last weekend, the sun came out, suddenly it was spring. And there was a very, and it was Mother's Day, there was a very human kind of response to that, to get out in the fresh air. But we can't see that repeated. The weather's going to get even better. We're heading into summer. People have to realize that this is really serious. And the only way to defeat it is to keep the NHS working. And the only way to keep the NHS working is to flatten that curve so it has longer to deal with this. And we prevent the kind of problems that we've seen so graphically in northern Italy.
Shami, and that is obviously what we want most of all, is to avoid going along that same graph as Italy. Yeah. Is there anything missing from this? You raised construction workers. I don't know whether you've looked at the details on this with your sort of legal lawyer's hat on. Is there anything missing from this that you think still needs to happen and happen urgently?
I think there will be more questions. There will be more detailed questions about people's lives. And that's not a criticism. It's just that the government will have to constantly respond. So, as I say, construction is one area. There are other areas of work where there needs to be greater clarity that this is not essential work. I know that there are concerns about families, that split families, where there is shared contact between 2 households. Then there will need to be some clear guidance about that. But my biggest concern tonight is really for the most vulnerable in our community. We have got to pull together. That means everybody, and that means we're only as strong as the weakest and most vulnerable, those literally on the breadline, those on the gig economy, carers, vulnerable people who are really, really worried about how they're going to cope without a cushion through this crisis.
Thank you all. Thank you all very much indeed.